Most people don't understand what a truly normal blood pressure is. In fact, blood pressure is one of those things that people don't feel bad, even when they have high blood pressure. And unfortunately, that's one of the problems with cardiovascular disease and particularly hypertension. People have all of the consequences of having blood pressure that's not controlled, but they feel fine. I can't tell you the number of times that a patient says, "Oh, I feel fine," but their pressure is 160/90. Well, that 160/90 blood pressure is causing damage to their kidneys and damage to their eyes and damage to their heart. And so, unfortunately, most people don't even have a clue of what their blood pressure is. And I think we've grown to accept the blood pressure of 140/85 as a normal blood pressure, which it is not a normal blood pressure. What ends up happening is people go along for years and years and years of those blood pressures that are elevated. And again, they develop the consequences of it. Sequela of hypertension is the things like I talked about: eye disease, peripheral vascular disease, kidney disease. So with respect to cardiovascular disease, oftentimes the symptoms are very subtle. And symptoms like being fatigued, being tired, right? That's such a vague symptom that it could be lots of things. But believe it or not, cardiovascular disease and not being able to deliver enough blood supply to the rest of your body because of cardiovascular disease can cause you to feel that fatigue. So I think it's about understanding some of these vague symptoms that's likely are contributed to by having underlying cardiovascular disease.